To understand the difference between type 1 and type 2 diabetes, it is necessary to pay attention to several important factors. The difference between type 1 and type 2 is in the cause of their occurrence. Type 1 diabetes is usually seen in children. The cause of this disease is congenital and goes back to the failure of the pancreatic gland. Of course, it is also possible to occur in the elderly. The pancreas is an endocrine gland that secretes insulin. Insulin is a hormone that regulates blood sugar levels in the body. This hormone directs glucose to the cells of the body to supply them with energy. Glucose is the essential blood sugar that is freely present in the bloodstream. This sugar is necessary to fuel nerve cells, red blood cells, and the brain. When insulin is disturbed, excess sugar accumulates in the blood, and diabetes occurs. The body's immune system seems to recognize pancreatic beta cells as invaders and attacks them. In this way, insulin is no longer produced, so blood sugar will not be regulated. The cause of type 2 diabetes depends on diet and lifestyle. Diet means that you consume too many carbohydrates, fat, etc. Lifestyle means that you are sedentary or have bad habits such as smoking. The collection of these factors plays a crucial role in the occurrence of this disease. In this case, the pancreas produces insulin, but the body cannot use it effectively. So it is said that there is insulin resistance. The cause of type 1 diabetes is pancreatic gland dysfunction. The difference between type 1 and type 2 diabetes is also related to people with this disease. Type 1 diabetes is a congenital problem that cannot be prevented. That's why this disease is more common in children. Meanwhile, the second type is acquired and is more common in adults. Factors that exist in type 1 and 2 diabetes. Type 1 diabetes risk factors. Number 1. Age. This disease is more common in children. However, it can also occur in early adulthood. Number 2. Geographical region. People who live in northern areas are more susceptible to it. Number 3. Family history. If one of the family members has this disease, it is possible to occur in another generation. Type 2 diabetes risk factors. Genetics and family history. Children whose parents have this disease have a 20% chance of developing diabetes. If parents are involved with the disease, this probability will be doubled, about 40%. The risk of this disease in identical twins is between 70 and 90%. If one of the foals is affected by this disease, the risk of its occurrence in the other foal will be 50%. Obesity and overweight. The difference between type 1 and 2 diabetes can be related to obesity. In fact, obesity is considered the most critical risk factor for this disease. Central obesity and upper body obesity have the greatest effect on disease occurrence. Weight gain can lead to a decrease in insulin activity. The prevalence of this disease in people with low physical activity is 2 to 3 times higher than others. People whose body mass index is below 21 are less prone to this disease. Obese women aged 30 to 55 who are overweight are 40% more at risk. Meanwhile, 64% of men and 77% of women can prevent the disease by changing their lifestyles and diet. Age. This disease is more common in the elderly. With increasing age, the number of physical activity decreases. That's why the elderly are more at risk. Of course, this disease is seen in young people and even in children due to a lack of activity in society. Race. The difference between type 1 and 2 can also be based on race. It seems that Americans and Asians are more affected by this disease than other races. This can be attributed to their lifestyle and diet. Pregnancy. With the onset of pregnancy, due to hormonal changes, there is a possibility of diabetes. Women diagnosed with this disease during pregnancy have a 50% chance of developing type 2 diabetes in the next 20 years. High blood pressure. If you have high blood pressure, you are more likely to have insulin resistance. More than 70% of patients with type 2 diabetes also suffer from high blood pressure. 3 factors: obesity, blood pressure, and diabetes are directly related. The difference between type 1 and type 2 diabetes can be the occurrence of chronic diseases, such as high blood pressure. Polycystic ovary syndrome. The risk of type 2 diabetes is higher in women with polycystic ovary syndrome. In fact, insulin resistance provides the basis for the occurrence of this disease. Stress. The more stress hormones are released, the greater the insulin resistance in the body. These hormones cause the insulin-producing cells in the pancreas to be disturbed and not produce enough insulin. On the other hand, stress and anxiety can lead to overeating, which is why the risk of developing diabetes increases. Stress affects people differently, and the body uses various tricks to respond to it. With the occurrence of stress and mental pressure, the blood glucose level increases. If along with this disease, you experience stress, and anxiety for various reasons, it is necessary to identify the triggers and check your blood sugar level regularly. Smoking. Nicotine in cigarettes causes body cells not to respond to insulin, which is why insulin resistance is created. On the other hand, smokers are more prone to abdominal obesity than others. The combination of these factors makes these people 30 to 40 more susceptible to diabetes than others. The difference between type 1 and type 2 diabetes is also related to the onset and type of symptoms. The symptoms of type 1 diabetes appear suddenly and only a few weeks after the beginning of the disease. Among symptoms: visual disturbances such as blurred vision, frequent urination, extreme hunger, unreasonable weight loss, bedwetting in children, irritability, mood swings, weakness and fatigue, excessive thirst. Symptoms of type 2 diabetes will appear over several years. Usually, patients notice it when other body organs are damaged due to high blood sugar. Symptoms of this disease: thirst and dry mouth, unreasonable weight loss, blurred vision, excessive hunger and thirst, numbness in the legs and numbness in the hands, kidney problems, frequent urination, prolonging the wound healing process, gum diseases. Type 1 diabetes treatment methods: insulin injection, counting the amount of carbohydrates, fats, and proteins in the diet, frequent and continuous checking of blood sugar, having a healthy diet, maintain a healthy weight, regular exercise, pancreas transplant. The risks of this method of treatment are much higher than diabetes. For this reason, it is mainly used for patients who do not respond to ordinary treatment methods. Insulin injection and blood sugar monitoring are the most important ways to control type 1 diabetes. The endocrinology and metabolism specialist may also prescribe some medications to prevent the disease from progressing. Blood pressure medications, cholesterol, and blood lipid-lowering drugs, aspirin to prevent cardiovascular diseases. People with diabetes are more prone to cardiovascular diseases than others. Type 2 diabetes treatment methods: healthy diet, foods rich in fiber and healthy carbohydrates help keep blood glucose levels stable. Fruits, vegetables, and whole grains are among them. Snacking. Try to use healthy food and snacks at appropriate time intervals. This technique prevents sugar from falling or rising. To have a healthy diet, it is better to consult a nutritionist. Do not overeat in the main meals and stop eating as soon as you feel full. Regular exercise. If you have a suitable and useful physical activity for about half an hour every day, you will defeat diabetes. Weight loss. Losing weight means minimizing refined carbohydrates, sweets, and animal fats. Check blood sugar regularly. Regular checking of blood sugar can be effective in disease prevention and management. For this purpose, it is recommended to use laboratory tests in addition to the home blood sugar test. Diabetes medicine. Sometimes lifestyle and diet changes do not effectively help control high blood sugar. In this case, the doctor will suggest taking medicine. Metformin is one of the most common of these drugs. Most patients can control the disease by taking this medicine. Insulin therapy. If medication is ineffective for treatment, insulin injection is prescribed to manage the disease. The amount and dosage of the drug depends on the health status of the patient, but having a proper diet is the first option to treat type 2 diabetes. How do we know if we have type 1 or type 2 diabetes? A1C test is used to diagnose type 1 and type 2 diabetes. This test examines the average blood sugar level during the last 2 to 3 months. To do that, you need a blood sample. The higher the blood sugar level in the previous few months, the higher the A1C level will be. Other diagnostic tests include fasting blood sugar or FBS test, also known as FBG and FPG, glucose tolerance test or GTT, random blood sugar test RBS. Knowing the difference between type 1 and type 2 diabetes will help you to understand your disease better. The more you know, the easier you can control the disease. It doesn't matter which type you have. The important thing is that the progress of the disease can bring irreparable complications. Do you have high blood sugar or diabetes? What are some ways you can tell that your blood sugar is too high? And what are some things you do to ensure that your health is in good condition? Let us know in the comments section below. Enjoy this video, hit the like button and subscribe to our channel for more videos like this. Thanks for watching.